Hello everyone. So I hope you enjoyed your first two sessions with my colleague and dear friend Shahir Zaki last week. Today we'll continue with the same question. What would we do if we don't have a randomized experiment? How can we test the impact of any intervention or policy on individuals? Let me reintroduce myself again. I am Rasha Ramadan. I am professor of economics at Faculty of Economics and Political Science, Cairo University, and ERF fellow. And I'm really glad to be here with you today presenting this topic. So I know on the agenda today was supposed to be difference in difference and tomorrow PSM, but I think in the sequence and the storyline of the two sessions, I prefer to start today with the propensity score matching. Okay. So, as I said, an important question when we have a specific policy or program, we would like to measure the impact of this program on a specific outcome of the household. So, for instance, if I will take the example of the CAFL program, which is cash transfer in Egypt implemented since 2015. We wanted to measure the impact of this cash transfer on a specific outcome of the beneficiaries, and this outcome can be their income, the education level of their children, health status, whatever the outcome is. But the question that when we don't have an experiment or we don't have randomized data, the question will be always if any change that happens in the outcome of the beneficiaries is related to this specific program or related to any other characteristics. For some programs or some policies, which also we call treatment in our analysis, we can have primary data. So for instance, before imposing TACAFL program or Bolsa Familia program or any other program, the government can run a first round survey on these households to understand their characteristics, measure this main outcome, let's say is their income, and then remeasure this characteristics and this outcome again after the implementation of the program and compare how the situation of this household changed. And this is what we'll see more tomorrow in the methodology. However, in many cases, it's possible that after the implementation of the program, the government or the institution or whoever implements the program would like to compare or to see the improvement of the situation of the beneficiaries without having any initial data. So the main question is how can we compare the situation or specific outcome of a beneficiaries of specific program, which we will call treatment group, the group who had been treated or benefit from this program, and the non-beneficiary group, which we will call counterfactual group. When we don't have randomized design data, and when we know that the outcome, it can be affected not only by the intervention or the program, but by also the other characteristics of the individuals who benefit from this program. And taking into consideration that it's likely to have different distributions for the non-treatment variables that may cause selection bias. So let me give you an example. For instance, if I wanted to measure the impact of TACAFL on women empowerment, for instance, or on the income of women who benefit from this program, because it's mainly targeting women, the characteristics of these women before benefiting from TACAFL makes them being selected in TACAFL. So their age, their marital status, the number of their children, their education level. So this makes that there is selection bias, not like the random experiment. And we wanted to take this into consideration to make sure from our recommendation, if this really program has an impact, positive or negative or whatever on our outcome, or it is because of any other characteristic. And this idea was mainly used in also, initially in the medical or health sector, because in many cases it would allow to compare, for instance, a new medicine on a specific disease for some patients. So we want to compare between those who had been treated by this medicine with the other who have not benefit or use this treatment. So the question to answer, which was trying to answer during this workshop, is how to do in case of non-randomization. So we wanted to, in other way, I wanted to answer this question. If this woman had not benefited from takaful, how her income would be, or what her empowerment level would be, or what is the health of her children would be. So I want to see how or what would be the situation if this participant had not participated into the program. However, they already participated in the program, and we don't. To answer this question, we need to find a way or a methodology to compare themselves with their situation without the program. And this is what the propensity score matching is trying to do. So is it clear? Please, if at any point I'm not clear or I'm speaking so fast, please feel free to interrupt me or ask any questions. Okay? Okay, so the propensity score matching is trying to answer this question mainly by trying to find a group of individuals, which we will call a counterfactual group, and we will match this group of counterfactual with the groups of treated persons. So in other way, if Russia benefited from this group, and we find, from this treatment, and we find that Russia is more empowered after benefiting from takaful program. And we want to know if this increase in her decision power is related to being beneficiary of takaful or related to her characteristics. So we wanted to compare the situation of Russia without the program, but we cannot do this because she is already a beneficiary. So what we will try to do is to find a counterfactual individual, someone who has same characteristics as Russia before the intervention. We'll match her with Russia, and we will compare the the empowerment level of both individuals, Russia and our counterfactual individual. So the idea is try to match between individuals who had not benefited from the program, but they have characteristics close to the persons who benefited from the program. We match between these two groups based on characteristics before the intervention. And this is an important part of our talk today and of the PSM method. And when we match these two groups, we start comparing our outcomes between the group who benefited from the program and their matching group who did not benefit from the program. And this pre-intervention characteristics would affect the outcome variable, whatever outcome variable we want to measure, as I mentioned, income level, education, health indicators, empowerment level. Sometimes it is used in the labor market if we wanted to compare, for instance, any training or capacity building. For instance, assume in 1 year we wanted to compare your productivity and your research compared with your colleagues who did not benefit from this workshop. So we want to see the characteristics that made you intervene or join this program, and we'll match you as a group with other colleagues who did not benefit from this program. And in 1 year, we'll compare the productivity of both of you or your research. So it's also used a lot in the labor market to see the impact of any capacity building or any training on individuals' productivity or their wage or their income after this training or this program. So this is the idea what we call the treatment observations with what we call the control observations. And this match will be based on observable characteristics, as I mentioned, that affect the intervention of individuals in the program, but also affect the outcome. And this is an important point to keep in mind, because also this will be one of the critique of this method, of the propensity score matching method. And this is what we'll talk about, how we can overcome this tomorrow with a different diff. That here we are matching only on observable characteristics, because we know that there is selection bias. And this selection bias is based on characteristics. Of course, it can be based on observable and non-observable characteristics. However, with the PSM, we are controlling only for the observable characteristics that we can control for, and we can match between the control observations and the treatment observations we want to match together. So here we are not taking into account the possibility of having unobserved characteristics that may affect the outcome variable that we wanted to measure, or the possibility of being part of this program or benefiting from this program. And in this way, it's like we are mimicking the randomized assignment. So in the randomized assignment, we suppose that everyone can be likely randomly being selected for specific treatment or specific program. Here we know that it is not random, but we try to mimicking this by providing a given probability of being accepted into the program. Let me go in more details. So the PSM assume, as I mentioned, that the selection bias will be eliminated, but only based on the observable characteristics that we can observe, and this would reduce the overall bias. So I can conclude that this program is have positive impact on. If I will talk about, if I take takaful as an example, if the Egyptian government asked me to recommend if this program has really positive effect on children's health, for instance, so I need to make sure that the change in the health of the children of the beneficiaries of the program compared to the other, if it's really related to this cash transfer or to other factors, and if I reduce this overall bias, I can recommend to the Egyptian government that yes, TACAFL had a positive impact on the health of children, so we should continue it, or we should expanding our if it's not the case, so maybe we should cancel it and make another program. So this is really important to reduce the overall bias, to make sure that or to have a conclusion regarding whatever program or policy or treatment you want to measure its impact. So here, to be able to answer this main question and to eliminate the selection bias and measure the impact of a specific program or treatment on a specific outcome, there are two questions to be asked. The first thing, what characteristics should we use? So let's take again the example of Russia and Z. So should I match between Russia, who benefit from takaful, and Z, who did not benefit from takaful, based on their gender, their age, their geographical location, their marital status? What characteristics should I include in my analysis? And bearing in mind that these characteristics would allow me to match between Russia and or that treatment group and any other group. And this is really important, as you will see, because it would affect your results in your conclusion. It is one of the main factors that can change your final recommendation or results. And this is why we need to make sensitivity analysis, as we will see later. The second thing is which weight we'll put on each of them. So assume now that we'll compare between the treatment group and the counterfactual group based on 5 characteristics: gender, age, education level, employment status, and marital status. Which one of these 5 will give more weight or less weight, or will give them equal weights? This is another important question to measure. So again, the main idea is that I wanted to match or create a group who has equal characteristics as the group who benefit from specific program, to compare between my outcome variable of interest between this group, which is who did not benefit from the program, our counterfactual group, and the treatment group. And again, we can match based on several characteristics. What characteristics we would include? Should I include education and not employment status? Should I include age or not include age? If I include both, which one I will give more weight, or should I give equal weight? And the main idea is that these characteristics should affect the outcome variable and also affect the intervention in the program, or being beneficiary of the program. So these two questions are important to be asked and can affect your results. Rosenbaum and Rubin in 1983 found that, okay, let's not match based on individual characteristics or observable characteristics. So I should not only match based on gender or based on education or based on these characteristics, but we are not sure how we will give them their weights. So they said that let's match between the counterfactual group and the treatment group using a vector of observable characteristics and create a single dimension, which is the probability of being selected into this program based on these characteristics. And this is what we call propensity score. So instead of matching between two groups based on gender or education or employment status, no, I will collect all these characteristics that I found relevant for our analysis because it affects the selection into the program. So there is bias in this and affects also our outcome variable of interest, and we will create a propensity score, a value, one dimension, and this one dimension would allow us to match the different groups. Okay, and this is really important because if you use one dimension or sorry one characteristic or two characteristics, your counterfactual group will be completely different. So if we wanted to match between you and your colleagues who did not join this program, if we match based on the gender, the counterfactual group will not be the same as if we match based on the education level. It will not be the same if we match based on both. It will not be the same if we match based on the geographical location. So having this propensity, I mean, the selection of the variables will affect the treatment, the counterfactual group, and having this one dimension, according to Rosenbaum and Rubin, would allow to better match between the groups using this propensity score. And this is the main idea of the propensity score matching method. So the treatment and the control observations who are close, who are have equal, and I'm putting two quotes because we'll see that we will not have equal propensity score, but those who will be close in the propensity score space will be matched together, and this means that they are close along different characteristics. So if Russia with Z are matched based on the propensity score values because their both values are close, we can compare the outcome variable, let's say the empowerment level of Russia and Z, and we can conclude because they have close values of the propensity score, which means that they are matched, which means that as if they are identical, but one benefit from the program of takaful and the other one not. So any change in the outcome variable will be related or based on this only difference between both, which is the takaful program. And here we can conclude that takaful made Russia more empowered or less empowered or has no effect at all. Okay, so as I said, the propensity score is a probability or a score, a value that it is based on the different X characteristics. In other way, it is the probability of being selected into the program based on these characteristics. So X is a variable or a vector of variables pre the exposure to the program before being selected into the program. However, these characteristics can be can affect the selection into the program and can also affect the outcome variable. The T is the equal one if the individual is treated or if the individual benefit from this program. So if we have takaful program, it will be 1 if the individual is benefiting from takaful, 0 otherwise. If we are talking about specific training or program for the labor market, it will be 1 if the individual is selected or benefiting from this program, 0 otherwise. And PX, as I mentioned, is the probability of being treated or benefiting from this program or being selected into this program based on the characteristics X, and this will be estimated using probit or logit methodology, as we will see. And after estimating this, of course, we'll have different values of PX. So we'll have the propensity score of the different individuals, those who benefit from the program and those who do not benefit from the program. And we can start matching between the treated and non-treated based on this score. Any question till here? Any comment? Everything is clear? Are you with me? Okay, I will assume that no answer means that everything is fine.
Doctor, I raised my hand and I have one question.
Yes, madam.
Would it make sense, or is it possible to have a PSM that's for the treatment that's equal to the one in the control or the contrafactual group? Does it mean that they are both the same?
You mean they have exact value?
Oh, بالظبط.
I mean, yes, it's possible, and this is what we want to have. So let me tell you, in the randomized situation, the main idea is that everyone in this population have equal probability of being selected into the program, right? So this is
Yes.
the idea of randomization. Here we know that it was not random. So here what we are trying to do is like we want to see what is the probability of being selected into specific program, even if you were not selected based on your characteristics. So it's really possible that if I am treated in the program and you are not, that the P score or the P value of both of us is equal.
Good.
And this is exactly what we want, because and also this based on what we match the two groups. So here we have Russia and Ghana, who has the same probability of being selected into TACAFL program. We have the same values. However, Russia was selected and Ghana not. So if we want now to compare the income of Russia and of Ghana after the implementation of the program, and if my income is higher than your income, taking into account that we are supposed to be the same person, or like equal, because we have the same P score. So in this case, you can conclude that Russia's income is higher because of the TACAFL program. However, and as we will see, and this is why, if I return back to here, and why I'm putting between quotes close, because this is probability of being selected based on characteristics, you will never find two observations with exactly the same values. And this is why we are saying close values. And I will show you later when we start working application on STATA. So yes, we want to have two persons with the same probability. However, because it is a continuous number, we will not find two with equal probability, but we'll match between the close ones.
Thank you.
Any other question?
So, Professor, what is the threshold that we can say that those two people are close?
I don't know who is talking, but
Hala, sorry. Yeah, it's Hala.
okay. Thank you, Hala, for this very interesting question. This is, in fact, it's an important part of our session today, because
Okay.
exactly how can we match, especially as I mentioned, it is a probability. So, yeah, I mean, let me give you just a numerical basic example. Assume that I get the probability 0.345, and you get the probability of being selected into the program 3.335. Okay, is this close or not? And if someone else have, I mean, if we don't have any numbers between 0.345 and 0.23, so should we consider these two individuals close or not, if we don't have any close numbers in the middle? And this is an important question. And also, this is affected by the selection of your X. So the selection of your X would affect you the value of your score, and how you match between the scores is also affecting your results. And this is why we'll show you there are different methods of selection, of matching between the individuals on like, as you said, what is the benchmark that I would say that Russia and Ghana are close match or not? And also, this would affect your results. This is why you need to do sensitivity analysis. There are different methods, and you need to use the different methods in your analysis to make sure that your results are robust and are not affected by the selection of your X's variables or the selection of your matching method. So this is really very important question that we'll talk about it in a couple of minutes.
Thank you so much.
My pleasure. Any other question? Okay. So what are the steps? What should we do And of course, STATA will be doing all the steps when we just wrote one line, but we need to understand what are these different steps and what is the idea behind. So the first step, as I said, we need to have to estimate a probit or logic model where we will estimate the probability of being part of this program or of being selected of in this program. So this is the first step we wanted to do, to select the characteristics and estimate and estimate the probability of being selected into the program. Then we will use this predicted probability in matching between the different groups based, as I mentioned, on the distance or how close these two observations, the treated one and the controlled one in this program. And here, this propensity score is like the metric of distance. So based on the value, we will compare between the two groups or we match the two groups. Then after matching the two groups and making sure that they are equal in all the characteristics based on the probabilities, we will start comparing the value of the outcome of interest between these two groups. Whatever this outcome is, income, wage, education, as I mentioned. Okay. So here is the idea. So assume that you have here the density of non-participant, and here's the density function of the participant. And what we are trying to do is to find this region of common support, trying to find the individuals who have common density values based on our probability, predicted probabilities based on the X characteristics. And among this region of common support where we have participant and non-participant, we'll start to compare between the outcome of these two groups. And of course, we will see how we can draw this graph in STATA, and we'll see how we can compare the outcome variable between these two groups. And an important step to be done after finding this region of common support that include participant and non-participant, we will need to compare the values or the average values of the X variables we choose between the two groups. Okay, so in other words, if I am matching between the two groups based on age, gender, education, employment status, and marital status, for instance. So after matching the two groups based on the value of the P-score, we need to make sure that there is no significant difference in these characteristics between the two groups. Because if there is a significant difference, we are not doing a good job. Because again, the idea is that I want to see what would Russia do if she did not participate in the program. So I'm trying to find someone who has almost the same characteristics as Russia. So if I match Russia with Z and Z have different characteristics than Russia, I'm not doing a good job when I will compare her outcome variables. So this is why you will need to test the difference of the in average values of the variable X's between the participant and the non-participant before comparing the outcome to make sure that we are doing a good job. And this impact or this comparison between the two groups is what we call the average treatment effect. I want to know the average treatment effect of تكافل, of Bolsa Familia, of this training, of any program or any policy on the outcome variable. And this is how it looks like. So we have the average treatment effect. We will take the value of the outcome variable, which is our Y, of let's say it's the income. So the income of individual G, who is member of the treated group, minus the value of the income of the individual G, who is member of the control group or the counterfactual group, after matching between both, of course. So Russia minus Z, Ghana was matched with Y, so the income of Ghana minus the income of Y. Hala was matched with L, so the income of Hala minus the income of L. So we will do the difference between all individuals of the treatment group and all the individuals of the counterfactual group for, with every match. And we will take the average of this, and this will be considered the average treatment effect. Again, all the steps are done by our dear friend STATA, so you will have the final value of the average treatment effect, and here you can decide For instance, if the value of the income is positive after benefiting from Takaful program or after benefiting from this training, so this means that this training had a positive impact on the income of the individuals. And we are sure that this difference in their income is based only on the training. Why? Because we matched, we assume you did a good job in matching between the treated and the control group. Okay? As I mentioned, two important factors that the estimation of this average treatment effect and our conclusion or our answer to this question, if this public policy had a positive or negative, significant or not significant effect on the outcome we are interested in, two things will affect this result. The first thing, the variables included in the equation we use to estimate the propensity score, our observable characteristics, our X variable. So this really, the choice of these variables are really important to consider. And one important thing, so it really depends on what variables you select and the way, as I mentioned. So if we decide, for instance, to match only based on gender and age, you can find a lot of individuals who has similar age and same gender, okay? So here you will have a lot of sample or observations in your counterfactual group. However, you did not control for all the other characteristics that can affect the choice in your in the program. On the opposite, assume now that I want to make sure that I am really doing a good job in matching. So I will match between the individual groups and the counterfactual group based on age, gender, education, marital status, employment status, geographical location, number of children, how many children they have. The more you include variables, of course, the more you are sure that you are controlling for any observable characteristics that may affect your outcome. However, the more is difficult to find a close match. I mean, it's easy to find someone who has the same age as me, the same gender as me. It's also easy to find someone who has the same age, same gender, same education level, maybe same geographical location, but is it easy to find someone with same age, gender, geographical location, number of children, marital status, employment status, all this characteristic? Yes, the more variable, the better the results. However, maybe it will be difficult to find observations. So this is why it's important. So yes, we want to control for more variables to make sure you have a good match, but pay attention not to include many observables that you cannot really find the match for this person. Again, if I wanted to match between two groups based on age, education, gender, employment status, is maybe possible. But if also I want to include geographical location, number of children, marital status, if they are living in nuclear family or they are living with their parents, the more you include your variable, yes, you are sure that you are controlling for every observable characteristics affecting your outcome. However, it may be difficult to find a good match. Not a good match, a match in general, because how can I find someone with exactly the same characteristics of everything? So this is why the selection of your variables that are your observable characteristics that you will include in your model, this is what would affect your result, and of course the estimate of your treatment. And this will depend, of course, on you can as we will see, it's really sensitivity. I can start with 5 variables and have 5 variables trying to see the match. If I don't have enough, if I have more variables, I can include it and then see how the sample of my counterfactual observations will be affected. In which estimation researchers often use parents' education as IV, so maybe in PM. Okay, this is an important point, Hala. So Hala, as we all know, and as Hala mentioned, parents' education is an important variable when we talk about wage estimation. So think with me, Hala, and everyone. Do you think I can find someone who has same education as myself, gender, age, geographical location, marital status, employment status, And parents' education, I mean, yes, it's important. It can explain a specific outcome. However, it may be difficult to find a close match. But again, how we'll know if we can find a match or not, we'll see that you can include the parents' education with all your variables, and then you will check if you have enough observations to be matched with or not. If you find that these are very specific characteristics that it is very difficult to match with, in this case, you may change your variables. On the opposite, if I will tell you just take education and gender and age, I mean, I can match a lot of individuals based on their age, education, and age, but I will be not controlling for other characteristics like the experience, like the geographical location, like the marital status, the employment status. So again, this really important that you need to find the number of variables and what variables to include. And of course, the weight, the probit or logit model will be solving this issue. The second point or the second factor that would affect, again, is the specification of the equation or how also you will do the match. These are the factors that would affect your results. And this is why, as we will see, you will need to have, since you need to do sensitivity analysis where you change your variables, you include more variables, you change your matching method, and to make sure that it reflects your, how it reflects, it affects your results. Okay, what variable go in X? It really depends. So the first thing you need to look for is the variable that had affected the selection into the program. So if I take TACAFL as an example, so TACAFL programs, this cash transfer program in Egypt, it's mainly targeting women, but also you have male-headed household benefiting from this. Usually it is affected by, so it is conducted based on proxy means test. So the variables included are age, geographical location, of course, income level, how many children they have, if there are any income earner in the household or not. So you can start by including all the pre-intervention variables that affected the selection into the program and also affect your outcome variable. All these variables would affect the being selected into TACAFL, but also would affect the income level of the household. So this is the first thing you have to think about it. Also, it can be conducted by interviews, or you can obtain, if it's new program, I am not sure what are the variables that affected the intervention into the program. I can start talking with the designers of the program, with the beneficiaries, trying to understand what are the observable characteristics that may affect the selection and also affect the outcome variable. Also in the literature, if it is conducted before, I will give you at the end of the theoretical part presentation of good paper. I mean, it's old paper, but I think it's a very good example for the PSM methodology, testing the impact of Bolsa Familia program on child labor in Brazil. And if I want to do the same thing on TACAFL, I would see what in the literature had been included as a variable. Sorry, I can be included the same variables. And as we said, if you have a good observable variables to explain who participate and who does not participate, so you are doing a good job, you can make a good match. But if not, you will be doing a poor job in eliminating the selection bias. Keep in mind that the main idea is that we have a selection bias given that this implementation was not random, and we wanted to eliminate this to be able to measure the impact of the public policy or this training policy or this intervention program on the outcome of it. So this is how usually we select the variable axis. The question that Hala asked, how we choose or how we match between observations. So as I mentioned, PS, the P-score value, it is a continuous variable. So it takes value between 0. So there is no probability at all that the individual will be selected into the program, and 1, which is like very high probability that I will be selected into the program. So this propensity score that takes value between 0 and 1 is a continuous variable. So maybe we will not find any two observations with exactly the same estimated score. So we need to find a way to match between the two individuals or the two observations, those who are treated and those who are not treated, by finding the closest observation. Okay, how can we find this closest observation? So we have simple matching methods, and we have more complicated matching methods. I will give you two examples of simple matching methods and one example of the complicated matching methods, and we'll see it when we'll start working with STATA, how we can affect, sorry, how it change, it may affect your results. So you need to consider this for sensitivity analysis. So for the sample matching methods, we have one-to-one matching. This is very simple. So you will specify to STATA to match this observation, which is treated, with the nearest closest observation. Okay, and here I will return back to the this word nearest. How can we define the nearest? So if I have for one treated individual, we have 0.23 a score, and the nearest value of the non-treated individual is 0.45. So should I consider these two as near or not? So STATA also allow us to, one of the methods that we can do is that we can impose what we call a caliper. A caliper, which means that I would specify a tolerance level. So this treated individual will be matched with the closest, the nearest control observations till a specific point. Because, I don't want it to be the gap between the individual who is treated and the counterfactual observation. I don't want the gap to be 0.5, for instance. No, I want it to be maximum 0.06 or maximum 0.03, whatever I will specify. Again, there is no benchmark. You will have to make sensitivity analysis and try several values. So you can simply specify to STATA that, okay, find the closest, the nearest value, p-score value of the control group to match with the treated individual. So for each individual, you will have to look to all the values of the p-score of the control individuals and match them together. But also you can specify a caliper, a specific maximum distance that we should not go behind this or further than this value to make the match. Okay, so this is the first thing. Second, sorry. The second second way to do the match is to use an average of the nearest n neighbors. So I have here, this is the treated group. Okay, so I have all these values, and I have here the control groups with all their maximum values. So for this individual, assume this individual number 1, this one is the closest. Okay, so I can, if I will use one-to-one matching, I will match number 1 of the treated with number 10, for instance, from the control. But assume that all these other observations, this one and this one and this one, have values that are not that far from the value of number 1. So instead, and it will be also close of this observation. So instead of matching number 1 only with number 10, I will decide to match number 1 with the nearest 4 observations. So I will check the 4 treated observations that has values close to the value of the treated, of the p-score of the treated, and I will take the average between all of them. And in this case, I will compare the outcome of this one with the average outcome of this 4 persons or 4 observations. And here the same thing, we can impose a caliper. Yes, use the average nearest n neighbors till a specific distance. Also, the n neighbors, are there the 3 closest neighbors, the 4, the 5? It is based on your decision. You can see what was done in the literature. You can make sensitivity analysis to make sure that it's not really affecting your results. So you see that what variables you select in your model, in your equation to control for the observable characteristics, and how you match between the observations, it can affect your result. Because simply if I return to our average treatment effect, it would affect the selection of this YC, right? If you choose the outcome of the closest observation without control observation without caliper, it's not the same thing as you choose to compare with the outcome of the closest observation with caliper. It's not the same thing as you compare with the outcome of the closest n neighbors. So it really, you need to make different, you need to change all these factors and make different estimation to make sure that your results are not based on a specific choice of your methodology or of matching method or of the selection of your variables. And if I return here again, so for the nearest n neighbors, this is how it will look like. So our average treatment effect will not be simply the outcome of individual I of the treated person minus the outcome of the control observation of the I's individual. No, it will be the gap between the outcome of the I's individual of the treated sample minus an average of the outcome of the different individuals who are in the counterfactual observations. And here it is an average, so our weight is simply the average. We'll divide by the number of individuals in the control or counterfactual match observation of the individual I that we are matching together. Any question, comment? Is it clear? Okay. Again, I will assume no. Okay. Clear. Okay, perfect. Thank you, Hala. More complicating matching method, it is using a kernel matching method. And again, this also implemented in STATA command. So the kernel method or the kernel function, it is a non-parametric function. So it is embedded, as I mentioned, in STATA, which use weights or weighted average of all individuals in the control group. So the kernel method for each individual observation in the treated group will construct a weighted average of all the individual in the counterfactual group to compare together. And of course, this weights provided by kernel function to create this weighted average, it will depend on the distance between the treated observation and the control observation we are dealing with. So it will depend on how far or how close the value scores are between each individual from the control group and the participation observation for which the counterfactual is estimated. And again, the kernel method or the kernel function have different kernel functions and different bandwidth parameter, and the bandwidth parameter, it depends on, or it affects how smooth is the kernel function. Again, there are different values. We will see we have given values of the bandwidth parameter and the specific function embedded in the command of STATA, but again, we can change this. So we see that not only the matching methods that can affect, that you choose that can affect your results, but also within a method like the kernel one, the choose of the bandwidth parameter or of the kernel function, which one it can affect also your results. In other words, for the kernel function, the average treatment effect will look like this. We have the outcome of the ICE individual of the treated group. And here you don't have a simple value of the outcome of individual G of the T person or the average of the closest neighbor. No, you have the kernel function and you have a specific bandwidth parameter, and you weighted if you can see here, it is the outcome of, sorry, this is C, not T, the outcome of the different individuals in the control group or the counterfactual group. And in the kernel function, it takes, I mean, this weight, you are multiplying by this weight, and this weight take into consideration the distance or the difference between the propensity score of the individual of interest in the treatment group and the propensity score of the individual in the treated one. So the kernel function is more complicated, but it allows you not to match you only with the closest one, no, but with the weighted average of all those who are in the control group. And this weight will differ according to the distance between each observation and the other observation. And of course, if the bandwidth parameter change, it would change your results. That I'm coming from the future, and I know one of the questions to be asked, which one we can use or how many sensitivity analysis we can done. I always say try at least three estimations, as we'll see, one with the closest observation, one with the average n neighbors. Usually I take n as 5, and with the kernel matching method, the simple one embedded in STATA. If the 3 models give you the same answer, so great. Here it means that your sensitivity analysis will work. If you change the matching method, it would not affect your results. If you have 2 models saying something and the third one, 2 methods saying something about the impact of the program on your outcome, and the third one saying something different, maybe you can change the bandwidth parameter or change the n observations to just to make sure you are in which one. But it's really, you need to make sensitivity analysis to make sure that you are doing a good job. Okay. So again, it would differ between the matching methods, the variables you are using, also the estimation of your propensity score itself, if it is based on a logit or probit model. Again, the same thing I would repeat, that you need to make tests. So maybe, for instance, even in the variables you include, maybe if we are talking about the wage as suggested by Hala, yes, we know that gender make a difference and employment make a difference, but maybe also I wanted to include the interaction between the gender and the education, to make sure if one additional year of education would have the same impact on the selection into the program and the income of individual, if he or she is female or male. So maybe also you will include interaction. So it really depends based on the literature, and you need to do the sensitivity analysis as I mentioned. Okay. As I said, you have to make sure that you are doing a good match. If I match between the treated and the control groups based on age and education only, here you can match many persons. I mean, if I want to match even among us, the 18 persons based on age and education, PhD or master, I'm sure we'll find a lot of match. If I add the gender, we'll find less matches. If we add the geographical location from which countries we can find less match. If we add also the employment experience or employment status, we may find less match. If we add the marital status, how many children, we'll find less match. So this is really important to take into consideration. And once we created the 2 groups, we need to make sure that, as I said, the value or the average of all these variables that we include in our matching methods, our observable variables, which we are using to delete or to eliminate as much as we can from the bias, we need to make sure that there is no significant difference. If we find that there is a significant difference between the observable characteristics in the 2 match sample, and this is really simple. You will create your 2 samples, the counterfactual one and the treated one. You will match between both, and you will use a t-test to measure the difference of in the means of the x's or the variables you are including in your matching. If you find that there is no significant difference, you are doing great job, because this is the main idea. We want two groups that have no difference on average between both, except for their outcome variables, to make sure that this difference is only based on the treatment you are applying, or whatever program you are applying, or whatever policy you are applying. But if there is a significant difference in any of the covariates, any of the observable characteristics you include in your model, in this case, you are not really doing a good job. Okay. If I return back to, if you remember, this is the matching, the region of common support. And this region of common support, it depends on the characteristics we are choosing. So here again, if I include more and more variables, the difference between these two curves, these two density functions, will become far, and the region of the common support will be very, very small. So it will be difficult for us to match between both. And if we include less variables, this region of common support will be even larger, because here we can match between any two persons. So this region of common support, it depends on the selection of the variables. And this is why, if I come back here, you should examine the effect of the matching method on the area of the common support. Whatever variables you choose and the matching methods you choose, you need to check how this would affect your region of common support, because it is here that you will start comparing between your treated individual and your counterfactual individual. Here. The closer we try to make the match, the more likely that some treatment observation will not find matches. As I said, it will be very difficult, even only among us, to find, if I want to find a match to Russia based on age, gender, education, work experience, marital status, geographical location, parents' education, all these characteristics, it will be very difficult to find someone exactly with this characteristics. So it will be difficult to find matches, and would reduce the efficiency of your model, because simply you will have some treated observations that you cannot find a match counterfactual observation, you will not be able to take into account. So this will reduce the efficiency of your model. Okay. One important thing to consider here is that here, if we return back to the steps, we have kind of two steps. We first estimate a probit or Roget model. We calculate this propensity score. We match individuals. Then we estimate the average treatment effect. So here you have you are using a predicted value, which is which we will have a variance. An estimated variance of this propensity scores estimated, and then you will use it for estimating the treatment effect. So in this case, the variance of your estimator can be large, because it's not only estimated, it's not only based on the variance in your sample, but also it is based on an estimated or an predicted score that also has a variance. So this might increase the variation of your the variance of your estimation, and this is something that we don't want to have. So it's not only the normal sampling variation, but additionally the variation related to the estimation from the first step. And this is why one of the solution is to bootstrap, and this we'll see with small number of rounds, just to correct the standard errors, take into account that we have two steps, and we are taking the estimated propensity score to estimate the average treatment effect, to reduce the variance and make sure of the significance of our results. So as we will see. As I said in the beginning, and I mean, it is simply here the main idea behind the PSM, it is that we wanted to mimic the random experiment. And in random experiment, this propensity score is constant. We all know that we have the same probability of being selected into this social experiment. So there is no selection bias. It is not related to any of our characteristics. But because we are in a context where we are not in a social experiment or there is no randomization to control for this, PSM is trying to mimic this this situation by saying, okay, let's see, based on your characteristics, who are the ones that were more likely to be selected and others are not likely to be selected. And in fact, as we will see, as we see in the examples, it is possible that based on the observable characteristics that you choose, you have a very high probability of being selected, but you were not selected. So assume that Rasha, given her characteristics, have very high probability of being selected, but she was not selected into the Takaful program, while Ganna, who has the same characteristics as Rasha or the same score as Rasha of being selected, she was selected. So it's exactly this is what we mean by mimicking the social experiment, that we have two persons who had equal probability of being selected into a specific program and benefiting from specific policy, and one was selected and the other one is not, as if it was random, though it's not the case. But the main critique of this method, and this is why tomorrow we'll talk about how we can overcome this critique, and this is why I swapped the sessions, that here you don't take into consideration that there are unobservable characteristics that may affect the probability of being selected into the program or may affect the outcome. I mean, Ganna and myself, we can have the same exact characteristics, but for any unobservable characteristics, she is more empowered than me. So it's not because she benefited from takaful that her empowerment is higher that we can conclude that, yes, takaful is empowering women. No, maybe even if you control for the observable characteristics, there are unobservable characteristics that are not taken into consideration and is affecting the selection into the program. So Ganna had higher decision power, so she was able to go to fill the form of takaful, to follow the whole process and to benefit of it. And of course, she will be more empowered than me. But the PSM method have this critique that it does not take into consideration these are unobservable characteristics. It only, but you know what we can, ما لا يدرك كله لا يدرك كله. So if we have selection bias, at least let's try to remove the selection bias based on the observable characteristics using the PSM. Tomorrow we'll see that with difference in difference, we will be able to control for observable and unobservable characteristics. And also I will show you that we even can use both methods together to make sure that we are eliminating or removing any unobservable characteristics. Okay? Any question?
I have a question, Dr. Rasha. It's Riham.
Yes, Riham.
First one, I assume that I did not apply this method before, but I assume it's only for cross-sectional data, not panel data. That's my first.
Yes. So usually we use it for cross-sectional data because if we have panel data and you have the same you have the same survey for the same individuals year before, for instance, the program or whatever, it will be better to use difference in difference. But usually we use PSM when we have the cross-sectional data and we cannot compare the situation of the beneficiaries before this program or this policy.
Okay, thank you. That was my second question. So we do not have data on the level of income of one of the treated group before and after the program in this case, no? And the outcome variable we only have after the program for all.
Exactly.
Yes.
Exactly. So whatever your outcome variable you have for the treated and the non-treated, you have it at a specific point of time after the implementation of the program. So you cannot know what would be the income of Russia or her empowered level if she was not benefiting from the program. Because now she is benefiting, you don't have any information about her before the program. You will see if you have two surveys before and after, or if you have the information of this outcome variable before the implementation of the program, you can compare its trend, and then you can, as we'll see tomorrow, and then you can see I mean, it increased because of the program or for other reasons. But here, and this is why PSM is used a lot, because we have a lot of data that it's only cross-sectional. You don't know the situation of the individuals before this program or before this treatment. So let me give you an example. A joint paper of Marina Hisham, who is colleague in at Faculty of Economics and Political Science, and she's doing her PhD with us. So what she tried to do, she wanted to see if the treatment, and the treatment in her case is violence against women, if the mother is beaten by her partner, this would affect the health situation of children. So her outcome variable was the situation of stunting of children, and her treatment is violence against women. So we are using the GHS, and here we don't know if this woman was, we don't know if this child was suffering from any health situation or something before that the mother had been beaten or not. So we are using PSM trying to control for this. So based on the observable characteristics of the mother, what is the likelihood that she will be a victim of violence? Okay. So here we match between women who have the same scores, which means the same characteristics, but one had been victim of violence and the others not. And then after matching between these mothers, we are trying to compare the health situation of their children. And we found, unfortunately, or as expected, that women who are victim of violence, it's more likely that their children have problems in their health, like diarrhea, stunting, psychological problems because of neglect. So here, usually we use in cases like this, that you have a treatment or a program or a policy that is implemented, but you don't have any other information than what you have in this cross-sectional data after the treatment had been done or the program had been done.
Thank you. Thank you so much.
Thank you. Okay. Any other question? Okay. Another way of using, okay, yes, this is what I was saying. So another way of using the propensity score, so it's to use propensity score weightings. So again, if I revise the steps that will be magically done by STATA by only one line of command, and then it will provide us with all the steps, we select the variables, we estimate the probability of being selected into the program or of being victim of violence as my example, or of being selected into training or capacity building program. Based on these excess variables, third step, you use these scores to match between treated and counterfactual observations. Third step, you calculate or you estimate the average treatment effect by comparing the outcome of interest of your research question with the outcome of interest of your matched observations. Okay. And then based on the average treatment effect, you can conclude, yes, this program is amazing, is doing a great job. No, this program should not be implemented or expanded, whatever. Another way of using the propensity score values is to use it as a weight in your, in your estimation on your regression, as we will see. So we can do what? We can estimate the propensity score values and then use it as weight for the sampling. And even if you have the sampling weight in your survey, in your analysis, you can, as we will see, you can combine both and use it as a weight. And this is what we call the inverse probability of treatment weighting. What is this? So we'll do the same steps, estimate the probability of being selected into the program using logit or probit, then calculate this weight. So look at me at this weight. You have TI, which equal 1 if I am treated, 0 otherwise, based on the propensity score, my propensity score giving my matching, plus 1 minus TI, so if I am not selected, divided by 1 minus the probability of being selected given my characteristics. So if I am treated, my TI equal 1, this part will be removed. So my weight in this case will be 1 over the estimated probability of being part of this program or being victim of violence or being treated by this medicine or being part of this training program, okay, given my characteristics. And if I'm not treated, this part will be 0, and that will be 1 over 1 minus the probability of being selected into the program. And here, what is the idea behind that? If my characteristics, if the characteristics we are including in our analysis say that I am likely to be treated, but I am not treated, so in this case, I will give these individuals low weights because they were likely to be treated, but they were not treated. And the opposite. Again, if given my characteristics, I was not likely to be treated because I don't know, I don't have the given my characteristics, I have higher income than I'm supposed to be, or I am older than what I'm supposed to be, or whatever reason, for giving my X's, the probability of being selected into this program was very low. So I was unlikely to be selected into the program. However, I was selected. So in this case, because I am treated, so 1 over pi hat, the estimated probability score will be a high value. So in this case, I will give high weights for the individuals who were not supposed to be treated, but they were treated. And the same, if given my P score, I was likely to be treated, but I was not treated, which means that it's like as if there was bias in the selection. I was not chosen, though I was supposed to be chosen given my characteristics, or I was chosen, though I was not supposed to be chosen. So in any of these two cases, you will find that the weight will be high value. So I'm giving these observations more weights. They are an example of the selection bias and of the fact that this process was not random. So we are correcting for this selection bias that these persons were not supposed to be in this program, but they are with us, so we'll give them higher weight. And you can, as we will see when we use STATA, we can estimate the regression. So we have our outcome variable. We will have our treatment as a variable in our regressors. In our analysis, we regress our outcome variables on all the x's plus our treatment or our program, but we correct using these weights and we can see the results. And this is a good way also for sensitivity analysis. You can run this regression, and you can even run without these weights in the beginning, and then use these weights. You can also use the PSM and compare all your results. And if everything is fine, you are supposed to have the same conclusion. Yes, this program is very good. It is amazing. It is empowering women. It is making sure that children are going to school. Or no, this program has negative effect on whatever your outcome variable. Okay. Any question? Any comment? Okay, so before taking a break and moving to the more fun, interesting part using STATA, let me just show you this paper, or the main points of this paper on the influence of Bolsa Familia, which is conditional cash transfer program that is very successful in Brazil, and it was the main inspiration of many cash transfer programs worldwide, including the TACAFL program in Egypt, that use PSM method. And again, I said it is an old paper, but I believe it's a very good example of the implication of the PSM. So poverty is known in the literature as a main cause of child labor. And being a child of a poor family, being obliged to go to the labor market, it would increase or make you in this vicious circle of poverty, because you will have a low education level, you will not have good job or good income in the future, so you will remain in the poverty trap. And many policies, including conditional cash transfer, especially this type of cash transfers, is conditional on the human capital of children, to make sure to send children to school and to follow up with all the health related checkup. So this paper tried to measure the impact of the cash transfer program Bolsa Familia provided to the families on time allocation of child labor in this household. So they use the National Household Sample Survey. So returning to Dr. Riham's question, it is a cross-sectional data. We don't have information on what happened before Bolsa Familia for this household. They had a sample of individuals who are suitable for receiving Bolsa Familia. Receiving or not, I mean, this is a treatment, but our sample, they have all the characteristics that would make them eligible for this program. Mainly, they have children between 0 and 17 years old, and their per capita income is lower than $139. And they measure their outcome variable of interest. Their Y in this case is the hours of work spent by children. So this is the outcome variable, and the treatment is the Bolsa Familia, as we mentioned. What are the characteristics they included? So again, the excess should be affecting the selection into Bolsa Familia, and also the fact that children are working. So they use the children's characteristics like age, the race or the color of children. They use the characteristics of the parents, like the parents' education, the net income of the household, if the household is headed by female, if they are living in rural or urban areas, if there are other children in the family. So as you can see, all these characteristics affect being poverty, which would affect being selected into the Bolsa Familia program, but in the same time also affect the outcome variable of interest, which is the working hours by the children. So here, this was the first step that we will see in our results after the break. This is the estimation of the PSM. The first part is it is the traditional estimation of a probit or logit model. So you have all the variables of interest you included, or your x's, the coefficient, the standard deviation, and it is showing you the factors affecting the probability of being selected into Bolsa Familia program. Okay, what are the main results? It was found that further schooling, age of children, having a female head or being black, it would increase the probability of being member of Bolsa Familia, because simply it increases the probability of being poor. Higher school attendance also increase the probability of family to participate in the program. Higher income per capita, of course, would decrease the likelihood of being participating in the program. Having an educated mother or living in an urban area would decrease the probability of being selected into the program, and the greater the number of children would be the more likely that you participate in the program. So given all these characteristics, given this estimation, we can simply estimate the probability of being selected into the program, which is our P score, or our, this again, mimicking the real situation or the random situation, that what would be the probability that everyone would be selected into the program if they are selected or not selected. And this will be the second part of the STATA command PSM. It will show you the average treatment effect. So you have the treatment number of individuals in the treatment group, in the control group. Your variable of interest is the hours working by children. And here you see that the average treatment of the average treatment effect is 0.525, which means that, unfortunately, being part of Bolsa Familia program increased the number of working hours of the children, which means that, yes, Bolsa Familia may have positive impacts on other indicators, but there is no positive impact on reducing child labor. And this may be because they are very, very poor, this household. So even if they are member of Bolsa Familia, they cannot stop working, and they have to let the children working. So here you see that if you wanted to provide a policy recommendation, Bolsa Familia is have significant positive impact, or in other words, beneficiaries of Bolsa Familia, their children are more likely to work, or are more likely to work by 52% compared to those who are not benefiting from Bolsa Familia. So here you can recommend to have other programs, not only providing cash transfer, maybe raising awareness campaigns, maybe making sure that the conditions of sending children to school is really justified or verified. So this is how the PSM method used to measure the impact of specific treatment or program or public policy on the outcome variable. Any question? There are some reference for your own interest. Any question, comment?
Yes, Professor Rasha.
Yes, please go ahead.
I'm quite confused because we've seen that the dependent variable is continuous hours of working, but we still use logit regression.
No, so let me use this. So you use logic to estimate the probability of being selected into the program. Okay, so you use the
So this
probability.
is for sensitivity analysis?
No, so you use first the logic that
Okay.
you are treated. So your treatment equal 1 given your characteristics.
Okay.
Let me give an example again. Among all of you, I will use all your characteristic to, and not only you and the other, we received, I think, 200 applications. So we'll use all your characteristics to calculate the probability of being selected into the program. So here the variable of interest is binary. 1 if you are selected into the training, 0 if you are not selected.
Yes, exactly.
So we are using a probit or a logit model. Okay. After estimating the probit or logit model, we have for the 200 applications a score telling us if this person is more likely to be selected into the training or not. So we'll have someone who has given their characteristics, the p-value is 0.1 or 0.05, while others it will be 0.7 or 0.6 or 0.8 based on your characteristics. Okay, from the 200 application, 25 were selected. So I wanted to match this 25 who were selected with others from the 165 applications who were not selected based on the score. So Hala have a p-value, a predicted p-hat, let's say 0.7. Okay, so you were likely to be selected and you were selected. And let's take an example, Mazen, who I know who applied for the program, and the probability of Mazen who was not selected is 0.69. So both you have equal score or close score. One was selected and one was not selected. Here I assume that I'm not taking the gender into consideration. Based on other characteristics, I match both of you and I decide to compare the number of papers you published in the coming year based on this training. So here, the number of papers you published is a continuous variable. And I want to see the impact of being selected into this training on this continuous variable. So this is why being selected in the program, it is binary. I use a logic model. I calculate the propensity of being selected. I match between individuals, and then I will compare between both of them. If in 1 year you publish more than, let's take another example than Mazen, Khulud. So you and Khulud, you have the same characteristics, the same score, everything, but the only difference that you were selected into this training and you benefited from this training. If in 1 year you have more publications, this I can say, okay, ARF is doing a great job and the program have a positive impact on the number of publications. So we are not using the logit or the probit for measuring the impact. No, we are using the logit or the probit to estimate the probability of being selected into the program, to be able to match between those who work in the program and those who do not work in the program.
Thank you so much. Yeah, I can now say I understand PSM. Thank you so much.
Any other question?
Yes, I have some question, please.
Yes.
For the second stage, we do not have a set of control variable. We have only the PSM score. Yes. For the second stage, the effect on the outcome.
Yes. Yes. So
Okay.
at the second stage, so you only match based on the PSM.
Uh-huh.
Okay. So you estimate this logit model. You will calculate the p hat with the p hat, which is a predicted probability. You match the two groups, and then you apply this or you estimate this average treatment effect. So you don't have controls or regressions. We already included in the first stage.
Which means that for my outcome variable, I will not have a regression model depending on the nature is continuous or binary or
No.
no. Okay.
Unless, but just one clarification. If you decide to use the propensity score weighting, as we see, here you will do the regression, for instance, if I take the example of Bursa Familia, so our variable is the number of working hours by children. This is a continuous variable. So you will regress, as any regression you are used to do, you regress your continuous variable, the number of working hours, on all the characteristics of the household, of the child, of the community, and you will just correct for the weight using the PSM. This use the propensity score weighting. So your outcome variable, if it is continuous or binary, it will make a difference. But if you use the PSM method directly to calculate the average treatment effect, which I cannot find. So yes, this your Y, it will depend on your Y.
Okay. Thanks. Another question, please. You mentioned that some of our variables in the first stage are not significant. I'll keep them as they are. I will not drop them from the equation, no? Meaning, if they are not significant, does this imply something? Should I drop them or do something for the matching and so on?
So for the, let me return. For the probit or the project, okay?
Yes.
It's better to include, to make sure that all the variables you include in your model are the one who are significantly affecting your the probability of being treated or of being selected. Okay.
Yes. Okay.
But what I meant by not after this stage, so here we have, almost all variables are significant. Father schooling and age are not significant, but it's okay. You here for the first step, you are supposed to do or to check all the post estimation tests that you do to make sure that your estimation is okay. Okay.
But I keep them.
Yes, you keep them. Then you estimate the p hat and you match both together. After matching the treated with the control, now you have to compare the mean value of these variables that you are including in your regression. So you compare the mean of these variables for the participant, for the treated, and for the counterfactual. If you have significant difference between the two groups, this means that you are doing a bad job. Because here you are matching based on the characteristics, but in fact, the treated individuals have different characteristics than the counterfactual program. So how can you match between them? So assume, for instance, I am a group and you are a group. I am treated, you are control. Okay, we were matched based on these characteristics. But then when we compare the average of these characteristics between both of us, for instance, you find that my school attendance is significantly different than your school attendance. This is an indicator that you are doing a bad job, because this means that Rasha and Riham has a different in their characteristics, and not only because Rasha was treated and Riham not. So you need to make sure that all the variables, the difference in the variables between the treated and the non-treated are not significant. But for the first stage, you have to apply whatever, whatever tests you do to make sure that your regression is correct. And just, I always say this, sometimes having non-significant variable does not mean that, it is in itself, it can be a result if you are sure that your model is correct, that the variable is correct. I always say, whenever, of course, I believe now that I'm working on women empowerment, because I'm giving all the examples on this. But in all the research I did on women empowerment, I never found education as a significant variable on empowering women. Whatever sample I am using, whatever data I am using, I mean, this is known in the literature that yes, education is not really the key factor of empowering women regarding taking her decision inside the household. Or education is not the factor that would increase females' participation in the labor market, given that we are doing a great job in the region in females' education. However, this is not translated in the labor market. So I would keep education. I would keep education if my probability is to being empowered. However, I mean, it's not significant. It's not significant because, yes, education is not significant in the likelihood of being empowered. Okay? But then, okay, no, but just the last comment. So, but then when I will match between empowered and non-empowered women, if the average of education between the two groups I match is different here, okay, this is not good, and I have to redo the analysis with other variables or to use other indicators of education, for instance.
Okay, thank you. My last quick question, please. For the PSM, we are just dealing with selection bias, but not with indigeneity. I had this question in mind because, for instance, since it's a cross-sectional data, I think that family income will be endogenous with the probability of being selected in the program. If I'm selected, so I have more money, so my family income will be higher. So we ignore this fact. We are just dealing with selection bias. We do not solve for indigeneity at this stage, no?
I mean, yes, you are trying to do better because think about it. If I don't use PSM at all and I will only use a dummy variable, okay? So assume, for instance, I will run a regression with my, the same as Bolsa Familia example. I will run a regression. I have the number of working hours of the children. I have all these indicators and a dummy variable reflecting 1 if I am benefiting from Bolsa Familia, 0 otherwise. Here we have a problem of indigeneity, as you mentioned, because I am poor, I am in Bolsa Familia, but because also I am poor, I will be sending my child to labor or to work. So we have a problem of indigeneity. We have a problem of selection bias. We cannot control for. So we'll use PSM. Yes, we will control for a part of it, given the observable characteristics, but you cannot control for the unobservable characteristics that may cause indigeneity as well.
Okay. Thank you so
And
much.
this is
Thank you.
why diff and diff is better, but you need to have data. And if you don't have data, you will be able. This is why I said so. If you use only a dummy variable, you are controlling for the importance of this program, but you have a problem of indigeneity and selection bias. But a PSM would be a step forward to try to correct for this. However, you still know that you can have indigeneity because of other unobservable characteristics affecting both together.
Thank you so much. Thank you.
My pleasure. Any other question? Okay, so I suggest to take like 10 minutes break. Then we return back with, I would say the fun part is STATA. I don't know, Ramaj, you don't have the data set we'll be using, no? Can I send it to you right now and share it with all the participants?
Yes, sure.
So I will send it to you now. Let's take 10 minutes break and return back with STATA. I will share with you the do file after. I mean, I think we share everything with you. But just I want to send you the data now so you can see it and if you try to test it while we are working together. See you in 10 minutes. Okay. Welcome back. So now we'll start the application of what we saw till now theoretically on STATA. Okay, so let me just update this. So originally this training was conducted by Dr. Raji Asad and Dr. Caroline Kraft before Shahir and myself we start delivering it. So our presentations and our do files are based on what was originally delivered by Dr. Raji and Dr. Caroline. So this is why you will find it in the reference of our presentations and do file. As Shahir mentioned in the first session, it is really important. I mean, the do files, if you are working with colleagues from other countries or with your supervisor, if you are doing your PhD, or even with yourself, I mean, trust me, usually if I work on data set today and tomorrow I will check what I did. Sometimes I forgot why I did this or what was the step. So this is why I prefer to write everything or many comments in the do file to make sure that we are I mean, I'm keeping track with whatever I am doing. In the data set I sent you that we'll be using in this analysis, in this example of PSM, it is a working version of the ELMPS 2006. And as usual, I always like to seize any opportunity to thank ERF for the fortune of data set available on their website, on OAMD website. It is really important and significant for applied researchers as us. So this, I mean, 2006 is one of the rounds of the ERMPS, the Egypt Labor Market Panel Survey and here you have the same individuals followed over years, so you can use it in the diff and diff method that we'll use it tomorrow. We have only here part of the observations, around 37,000 individuals. And what we wanted to see in this exercise, we wanted to see if the households who have an immigrant, mainly the man of the household is migrating in another country and sending remittance, how this would affect women's situation, mainly female labor outcome, and we have many variables. So I will go with you through the different commands of the do files, and we'll start running the PSM data to see, sorry, the PSM command to see the results we were talking about. So here first I am here one of the advantage that we can do if we have several, I mean, if we are several authors working on the do file, or if you are working on different computers. So in the beginning, I specify for STATA using the command global that my original data exists in this path or in this file. And so this is the original data. And also I will specify to STATA to save any command, any file I will work on. I'm someone who prefer to save different versions of my data sets, because usually it is very hard to get the data. So if you rewrite on it, or you save it after deleting any variables or anything, you will lose the original data. So I always prefer to save the data I have under a different name to make sure that the original version I already have. If any command or anything is not clear, please stop me to or ask any question you want. Okay, so I specify to STATA where to find the original data and where to save this one. I open a log file to save all my results. Okay, to save all my results, and I name it with today's date. And here is the data. Why it is doing this? No, stop. Here is the data we will use. As I mentioned, it is a part of the ELMPS data. We have, let me make this larger, sorry for that. Okay. So here we have the individual's household identifier. We have the governorate. We have also the 6 regions of Egypt: Upper Egypt and Upper Rural, Upper Urban, Lower Rural, Lower Urban, and Metropolitan. We have a couple of variables that we'll use in our analysis that we'll select as our axis from it. We have the different dummies for the education level. We have the age of the individuals. We have this, our outcome variable, if we have a current migrant sending remittance to their households in Egypt or not. We have the age square. We have the household composition, if there are elderly in the household, the number of children between 0 and 5, and number of children between 6 and 14. Here we have the weight of the sample, the sampling weight from the data. We have the 4 variables of outcome, our outcome variables of interest. We have labor force participation, if women are in the participating in the labor market or not, women aged between 18 and 49 years old. We have women who are working as wage workers. we have women who are non-wage workers, and if they are participating in subsistence work. In the do file, we'll find the analysis for the 4 variables, but for the sake of time, I will focus only on the first outcome of interest, which is female labor force participation. So these are the individual variables we will be taking care of. As the literature shows, the literature regarding women empowerment, female labor force participation, not only the individual and the household characteristics matters, however, the community, the context where women live would make a difference. I might accept violence if I am living in a community or in a governorate where other women are victim of violence. I may be more willing to go to participate in the labor market and to find a job if I am living in a community where women are working. This is why we will include, so these are variable X's that may affect our variable of interest, female labor force participation, if the women are working or not, are in the labor market or not. So we will include the share of males between 18 and 64 years old who have intermediate degree at the Shiakha level. So Shiakha in Egypt, we have governorate, which is the main administration unit in Egypt, and we have Shiakha, which is smaller than governorate, which includes several households. So this what the variables at the Shiakha level we are using in our analysis here as indicators or as proxies for the community in the context where women live. We have also the share of males who are who have university degree at the Shiakha level. We have the share of men employed in private sector, share of men working in the agricultural sector, and share of men unemployed. Why we are focusing on men? Of course, this also the reflection on or the characteristics of the community where she lives. If men are educated, if they are working, it would affect her participation in the labor market, the social acceptance of her being participating in the labor market, and also would affect our treatment, the fact of having a migrant in the household, if the man decide to leave the household and migrate and send remittance. Okay, let's return to our do file. So here I was just showing you the variables. You have a couple of commands to see what are the regions, the marital status. So the variable of our the treatment in our case, having a migrant in the household, is the variable CMIG listed as current migrant, and you see that you have around 4% of the population of the sample or 5% of the sample who are migrant. Okay. We will keep those who are between the age of 15 and 49 because our question regarding female labor force participation is for women in this age. I will keep this one. And as I told you, I'm always concerned to losing my data, so I will save it under another name, PSM data, age 15 to 49. All right. Here are some commands to show you the characteristics of the sample. For instance, here I am running, I wanted to see the university share of male university by Shiakha. So you have the different Shiakha codes and the share of university. Now, let's go to our main question that will use the PSM to apply to answer this question. So we want to see what is the impact of having a migrant in the household sending remittance on labor force participation. Okay, we will focus on women who are between 20 and 49 years old. So the whole sample is between 15 and 49, but we focus on those who finished school, supposedly, and university, because our variable of interest, our Y, is female labor force participation. And here it will bring me to the question of Dr. Iham at the end. The variable of interest, binary or continuous variable, it will not make a difference for us when we are using the PSM method or the PSM command because our treatment is a binary one, and then we will match, so we will use a probit or the logit to measure the probability of being selected in this treatment or in this program or being treated, which means in our case here have a migrant in the household. And our outcome variable, whatever is binary or continuous variable, we can just compare between the treated and the non-treated groups. However, if we run regression using the propensity score as weight, as we'll see at the end, here the nature of the outcome variable, if it is binary or continuous, will make a difference in our regression, as we will see. What are the variables that we will include? What are our x's? So again, I will focus on individuals who are between 20 and 49 years old. I will include, based on the literature and based on the data available, the age and the age squared of women, the education level, if she is ever married, so if she is married, widowed, or divorced, number of children under 6 years old, and those who are between 6 and 14 years old. As we know from the literature, number of children is a major or a key factor in affecting female labor force participation, of course, as we know that in our region, the traditional gender role that women are the main caregiver. So if she has children, she will be less likely willing to participate in the labor market. For the variables, we will have also the number of elderly. Again, the same thing, as she is the main caregiver, she will be taking care of the elderly if there are any in the household. And the average monthly non-labor income, if the household have any other sources of income, this also would affect her decision to participate in the labor market or not. For the community variables, as I mentioned, we'll use variables at the Shiakha level. We have the share of males with intermediate and university education, and those working in private sector, agriculture, and unemployment. Again, for the sake of simplifying our work, I will put all these variables of interest in one vector. I will call x1 using the global command. Okay. So as you can see, global just specifying for STATA that you will have to put all these variables, the individual characteristics and the community characteristics in this vector x1, so I can use it more later. And just to give you again, our variable of our treatment is the migration, having a migrant in the household. Okay. Now we'll start with the PSM. So the PSM command in STATA is called PSM match 2. This command is not built in STATA. I mean, it's not available, so you have to download it first. So to download it, you have just to find it PS match 2, and then you will locate it in the link in the window of commands it provides for you. You will select it and download it. It is easy to be downloaded, but as I mentioned, it is not built in STATA, so you have to do it. There is another command that you can use also to implement PSM method in STATA, which is P-score. You can also download it. The advantage of it is a PS match 2. It provides more detailed results, and it can perform all the type of matching methods we discussed. The one-to-one, you can use caliper, you cannot use caliper, the average of the nearest N observations. You can also have kernel functions, so you have different ways to conduct it. Okay, I will use PS match 2. So if you wanted to try the command with me, I would recommend that you download it. Again, now, I mean, in the example, in the do file, as you will see when I will send it to you, you will find 4 variables that I consider as variables of interest. Women participating in the labor market, women who are wage workers, women who are not wage workers, and women who are working in the subsistence work. But I will focus now on labor force participation, and if I have time, I will check with you the other outcomes. And the aim is to test the difference in this outcome in female labor force participation between those who have households who received who has a migrant and receive remittance, and those who have no migrant. All right. Okay, so it is very simple. as I mentioned in the first session, it's one line that will do for you all the steps. It will take your variable x's, estimate the logit or probit model, calculating the predicting the probability of being selected into the treatment based on these characteristics, which is in our case having a migrant or not. Keep this in mind that a man would decide to migrate based on how many children they have, based on the age of their women, based on the education level, based on the income of the household. All this would affect also the decision of migrating and going to another country. We will focus on women on the age, as I mentioned, those who are have migrants, and we will focus on women living in rural areas. Of course, you can not specify or not work on this sample. You can work on the whole sample. But here, I wanted to show you that PS match can be combined with if condition if you want to work on a specific sample. I'm trying to make it larger to see. Okay. The command PS match 2 is as this. You have PS match 2. You write your treatment variable, which is in our case is having a migrant, current migrant. If it is violence, it will be violence. If it is takaful and karama, it will be the variables that equal 1 if they are beneficiaries of takaful. If it is a specific training in the labor market, it will be the variable equals 1 if they have training in the labor market. Okay. Then you write all your explanatory variables, the x's, the observable characteristics based on which you think that the selection in the labor market is affected, and the outcome variable is affected as well. And here, just for simplicity, because I specified to STATA in the beginning that x1 vector include all my variables of interest, so I will just call this vector $x1 if, as I mentioned, I wanted to specify those who are the specific group I talked about between 20 and 49 who are living in urban areas and receiving remittance. Okay, comma, outcome. What is the outcome variable of interest? What indicator I want to see if there is a difference between the treated ones, the household who have migrants, and the non-treated ones, the household who have no migrants. In our case here, in our example, is women labor force participation. And I specify at the end what is the type of matching that STATA will use to match between the control group and the treated group. Remember, all the steps we talked about, estimating the probit and the logit model, matching the two groups, comparing the average values of the x variables between the two groups, specific the common support area, and comparing or estimating the average treatment effect is conducted by STATA by using only this one step. This is why I have to specify to STATA which one to use. And here I wanted to start with a more advanced or complicated method, not the simple one of matching, which is the kernel method. The outcome of, or the output of the command PS match 2, which I will show to you now, includes 3 parts. The probit regression output, as the one we saw in the example of the paper of the Bolsa Familia, the average treatment for treated for each outcome. So for the outcome, we can specify different outcomes, but here I want to focus on labor force participation. So we have the average treatment that we wanted to calculate, and we have also the value of how many observations are treated and untreated. In other words, the common support area. Okay, I will take this. I will go to the command here. Just I want to show you something. Keep in mind, because this command create variables. You can see here in my variables window, the last variable is agri-land, which is the total agricultural land if the household have agricultural land. Just to show you, after running the command, what variables will be created. And I will run. Okay, so here are I don't know how to make it, you can make it larger. Maybe full screen. Okay. The first part of the so this is our command. So here they run probit regression. You have the results of any probit regression. You have the total number of observation, the pseudo R square, the p-values, you have the log likelihood, and you have all the variables you are including in your regression, or the variables X factors that you are the literature shows you that they are affecting your outcome variable and also the probability of being selected. Again, returning back to the question of Dr. Riham, you can see, Dr. Riham, that not many of our variables here are significant. However, I mean, we will keep it because we know that, for instance, the age and the education level are significant factors in labor force participation and in the decision of sending migrant outside the household. But as I mentioned you, whenever I was working on gender issues, I never found the education is significant. However, the number of children below 5 years old is significant, which means that this is an important key factor of the decision of having migrant. Usually, the man will be willing to travel to provide the household with more income if they have children, and also this would affect the number of or the decision of working by the mother, also the elderly, and at the community level, we can have that the number of the share of male who are or the community level in general affect more the probability of being of being migrant and of for women to go to work in the labor market. The share of men with intermediate education, or those working in the private sector, those who are unemployed. So this is the first part of the outcome of the probability of the PS match command for the PSM. You can see here, I don't know if you can see it. I'm trying to make it larger, but I don't know why I'm not succeeding in this. Several variables have been produced: P-score, treated, support, weight, and women labor force participation value of women if they are working. I will come back to this, but I wanted to show you that STATA did not only estimate the probit model, but also sorry, estimate the P-score. I mean, if you were the one who were running the regression by yourself, you would have to predict the P-score after the probit or the logit regression. However, with PS match, it created automatically the P-score. Okay, let me show it to you. Migrant labor force participation and P-score. Okay, we had a lot of missing. So you can see here the different value of the P-score. So for instance, this individual had very low probability of having a current migrant, given the characteristics, the age, the number of individuals, the children or number of elderly, the education, the community, where the sheikha where they lived, they have very low probability of having a current migrant. Okay, I'm trying to see if there are any other, I mean, I always like to open the data set and see just a couple of examples to see. Here you have, for instance, here it's all relative compared to the one we saw in the beginning. We have higher probability. So for instance, would all these are not current migrant, would they be matched with someone who have a current migrant with equal probability? This is what STATA will do it automatically. If we took this example, for instance, here you have okay, I'm trying to find example. Yes, here. So here we have this household, they are treated, they have a current migrant, and the probability of being selected or being treated, which means having a current migrant in the household, is 0.1. So it will be matched with another one who have the same characteristics, which have close value of the 0.1, but have no migrant in the household, who are not treated. Okay, and this will be done automatically by STATA, which we can see here. So in the second part of the output of the PS match 2, we have your variable of interest, which is women labor force participation. Okay, here you have the unmatched, and here you have the average treatment treated. So you have the average value of women in the labor force for the treated, and then you have the average value of the controls observations. The second line show you the one on the common support, the one who are in the blue line. If I will return to the here, the presentation, the one who are on the common support. Okay, and you have the difference. Here is the difference. It is 0.0869. This is the average treatment effect that we are looking for. And here you have the standard error and the t value. So let me ask you a question based on these results. Can we say that the labor force participation of the treated is significantly different of the labor force participation of women in the non-treated? In other words, women who have migrant in their household have participation in the labor market, which is significantly different from those who are in control who have no migrant. So this is the first question. And is this significant difference positive or negative? What can you say from this table? Anyone would like to answer? I plug my electricity for my laptop.
I can try. I don't know if it
Yes,
will work.
yes, sure.
I think there is a difference. There is a positive difference between treated and control, which is 0.08 in the second line or the second row, and the t statistic is greater than 2, so it's a significant difference. So we can say yes, it's significant. Yeah.
Yes, it's significant and it's positive. So we can see that the women who are in household treated, which means they have a migrant, have higher labor force participation compared to women who are in the household who are controlled, who are not treated. So this average treatment, this difference is what we calculated here, but STATA do it automatically. So they match the households, the individuals based on the kernel method, and calculate the average treatment effect for the individuals who are treated, because here you have for those who are unmatched. And in the third part, let me check. And in the third part of the output, they show you the number of treated and untreated. And as Dr. Yaham mentioned, because the t value is higher than 2, so we can conclude that this gap is positive, which means that women will participate more in the labor market significantly compared to those who have no migrant. This can be, I mean, in the literature shows that this can be possible because they have to work because their husband is not here, or maybe their husband are sending them remittance, so they are using it for entrepreneurship activities. This means that it would increase the participation of women in the labor market in the positive side. And again, this last table shows you the number of treated and the untreated who are in the common support, which is the blue line here. Okay, let's see something else. So this is the output that will come out just by writing the PS match to command. Let me show you.
Sorry, Dr. Rasha, I have a question in the last output.
Yes, let me come back to yes.
So in the third table, it shows the sample that was actually used for the average treatment effect on the treated, right?
Exactly.
So is there anything that in STATA can say that these two groups are actually comparable given the sample size or the difference between the treated and the untreated in the sample size, because the difference is a bit large?
No, I don't understand exactly the question. No.
Okay, so in the table, in the last table, it says that the number of treated is 237, while the number of untreated or the control in our case is more than 3K. So is there anything that say that this sample is actually balanced to have يعني a real comparison between treated and untreated in this case?
Okay, in fact, you don't really care about the number. It's not this what you should care about, because already if you remember, when we see the treatment in the sample, which is the current migrant variable, you see that we have only 4% of the sample who are treated. So it's expected that you have 237 treated, and you have a sample of 3,000 with whom you can match. Okay, so the number is not really the factor you should care or should worry about. What you should worry about was I was about to show you. So okay, let me wait. Yes, this one. As I mentioned, so you know now from this table. Let me fix this. Okay. You know from this table that you have 237 who are treated, and you want to match them with how to say, with one for each one of the 237 treated. You want to match them with one or with n observations or with the kernel from the 3,000 observations. Okay, and after matching, you want to be sure that they have common characteristics. But you don't have to worry that you have small number of treated and large number of untreated, which is expected given that already in the sample and in the population you have a small number of treated. What you want to worry about is the comparison between the average value of all the variables you include between the treated and the control. Okay, and this command PS test with all the then you write all the variables you are including in your regression, and here I am calling again my vector x1, and you have this table showing you the difference or the t-test between the treated value and the control value. And here you can see for the all p values it is larger than 0, which means that there is no significant difference between the values of each of these variable among the treated and among the control. And this is a thing that you should be happy with, that you are doing a good job, that from the 237 observations, you match it with whatever number from the 3,000, but this match is okay because you don't have any significant difference between the two samples, the treated and the control one. I don't know if I answered your question.
Yes. So what I understood, just to make sure that I understood correctly, so in the PSM, we don't really care about the sample size between the treated and untreated, but I care more about how much they are matched, actually.
Yes, exactly, because usually you will always have small number of treated, and you have this large number of non-treated, but the match is the important thing. And after matching, based on whatever how to say matching message you are using, the most important thing that this variable you have a p-value that is not significant. So this is the only I think this is the only time of my life when I am working with data I am happy of finding non-significant results. Why? Because this means that I don't have significant difference between the average age of the treated and the average age of the control, the education level of the treated and the education level of the control, which means that I am doing a good match between both the treated and the control group. So I don't have to worry about the number, just it's okay. And this average treatment treated show me that really having this treatment or this having a migrant would have a significant effect positive on the labor market or the labor force participation.
Okay, thank you,
Excuse me,
Dr.
Dr. Rasha.
Yes.
For the result interpretation, I'm just wondering if for the unmatched that's above ATT, it's also significant. Does it matter if it's significant or not? I cannot get the meaning of unmatched row here. The unmatched.
Yeah, the unmatched is you have the value in the treated and the control in general, but not between the matched ones. So between the 237 and this, I mean, okay, it's good that it is significant, but it's not really this what you care about. You
Mhm.
care about when you match the treated with the non-treated.
So I only care about the ATC, the average treatment effect, not
Yes, this is what
the.
you want to calculate. Here you are comparing with all the sample between those matched and not those not matched.
Okay.
You care
Okay.
more about, I mean, you should care about the match, because this really what shows you that if you have two persons have exactly the same characteristics or matched according to the same characteristics, but one has a migrant or one is treated and the other is not, but there is a difference in their outcome. So this is a number, the difference is a number that you should care for, and of course the test to show you if it's significant difference or not.
Okay, thank you.
Yusuf, among the criticisms raised by the reviewers, one common concern. Yes, exactly, Hala. So the problem when you include a lot of covariates in the first stage, this means that I mean, yes, you are supposed to doing a better job because you are including more characteristics that you control for to eliminate the selection bias. But it makes you more it makes the job more difficult to find a match. Again, if I take the example between you, if I wanted to match between individuals in this group based on the education, it will be very easy. I can find many matches. If I want to do it by education and gender, okay, it's very easy because I will find a lot of matches. Education, gender, and age, okay, I can find a lot of matches. But imagine among us, I wanted to match according on age, education, geographical location. I mean, how many person is from the same country here? I know that based on our criteria, we take into account the geographical diversification. But if I want to control for age, education, gender, geographical location, employment status, marital status, parents' education, I am not sure I can find two persons in this group that I can match together. It's true that I include more characteristics. It will be better to eliminate the unobservable characteristics, but it will be more difficult to include to find a match. And this is why I believe your reviewers were concerned for this. Okay? And again, this is why sensitivity analysis is important. So I don't know what area variables you are including, but you can try to remove if there are variables that are not significant or according to the literature, they are not the most important, you can exclude it and see how this would affect your result. Okay, so the PS test command is allowing you to test the imbalance between the covariates, to test how good is the match between your variables, and the good news when you don't have significant results or significant difference between both groups. Here I will show you the graph. So here you have the treated and the untreated, and of course you see here the common support area. So here you have the blue line as the one we show you. Here we have a more treated who have values, but we don't have they don't have corresponding untreated. So here the ones that you should compare between or match between. Everyone in this red bar can be matched with anyone in this blue bar based on the methodology you are using. Okay, so this is the one that shows you the common support. Okay, let's take another example here. Okay, so keep in mind that our conclusion from the average treatment treated that having a current migrant have a positive significant impact on female labor force participation. Women will participate more in the labor market if they have a migrant in the household. Here we are using the kernel matching method. Let me do the same thing, but using the closest observation, like ties, like the nearest neighbor in the match. I will run it. So here, instead of kernel as an option, I write the same command, but instead of kernel, I write ties. And let's run it and see. Here we have the same thing, the probit regression should not really change. Here we have the result of the average treatment treated. Here you have the common support part. What can you conclude? Before discussing the conclusion, let's first check if the match is okay or not okay using the closest observation. So I will return back to here, and I will run the t-test for the significance of the variables I included in my regression. And here I can see from all the p-values that we are doing a good job in matching. There is no significant difference between the average or the mean variables, the mean values of all our variables between the treated and the control group. So let's return back to the average treatment treated. What we can conclude from the table, from the average treatment effect for the treated, this line? Anyone would like to? Riham, would you
Yeah.
like? Yes.
Yes. I think it's no more significant now because the t is lower than 2 for the ACC. Although there is a difference not far away from the previous one, it was 0.08, now it's 0.07, but it's no more significant.
Exactly. So when we use another matching method, that it is the closest observation, we found that yes, there is a difference. It is close to the difference that we calculated when we use the kernel method. However, it's not significant. And this is why, Riyam, I told you it's important to see the ATT, because this is the one we are caring about, that is comparing the treated with the non-treated on the common support array. But here it is not significant. So here it is concern. If I am working on the study to provide a policy recommendation to the Egyptian Prime Minister to tell them that, yes, the more we have migrants, women will participate more in the labor market. However, in one methodology, it is significant. In one matching method, it's significant. In the other matching method, it is not significant. This means that it can be based on my matching method. As I said, so let's try a third method and see what would be the result to be able to conclude and to provide the right policy recommendation. I will do the same thing. I wanted to STATA to match the treated one with the counterfactual one, the closest. However, I want to make sure that this closest is not that far. I don't want it to be the gap to be 0.5, for instance. No, I will add a caliper. So here in the options, I will add caliper, which is the maximum distance, the maximum difference that STATA can go for. And I will call it I will specify 0.01. Again, this is subjective, but I don't want it to have a larger difference than this. And I will run it. Same thing, I have the the probit regression, and I have the outcome. Again, we have a difference. The difference is smaller now using this matching method, and still it is not significant. Okay, let's try a third method. I will try with the average in neighbors. Here I will do the same command, but I will use the closest, I will match my treated observation with the closest 3 observations. Again, it is subjective. I can use 3, 4, 5, we can test. I will run it again. Okay. And I will test the difference between the different variables. There is no significant difference. Good. I mean, now it is 2. So it is significant, but really on the edge. We can try again with other types of kernel function, or I can try to see it with 5 neighbors, not 3 neighbors. Yes, with 5 neighbors, I found that it is significant. So here I run 5 matching method. From the 5, 3 are significant. So I can conclude that there is significant difference between the labor force participation of women who have migrant in the household and those who don't have a migrant in the household. And in general, it is higher when I have a migrant in my household. So this is what I was talking about the sensitivity. Of course, we can choose to change the variables. Maybe we can include other community variables or other individual characteristics in the probit regression. But in any ways, you have to do the sensitivity analysis to make sure that you are not, your results are not really based on your matching method, because this is a major factor that affect the results. Here you have different matching methods. I will leave it to you to running to try it. As we said, we have we are expecting to have larger variance, given that we are using the predicted value of the probability, which is a p hat, to estimate the average treatment treated. So this would create a larger variance. This is why you can correct for this by doing bootstrapping, which is a random process, which would reproduce your result several times and then provide you with a variance based on the several times. Usually you will run it like for 100 times or for a large number of times, but you have to specify for the bootstrap the seeds a random value in the beginning to start with, and you can run it several times. Here, for instance, I'm giving you an example with just 10 rounds, but again, you need to make it like for 100 times or even more to get the average value of the variance and to reduce this variance related from the fact that you are not only, this variance is not only related to the sampling variance that we are used to work with when we are using any sample, but also because you are using an estimated value for estimating another value. Okay, also I will leave this for you to run it. I wanted to come to the last part because this will bring me to the question of why, if the y variable is sorry, if the outcome variable is continuous or it is binary. So here I will use the PSM as a score, as a weight to run my regression. Okay, so as I said before the break, I mean, if I run my regression, I regress female labor force participation or the decision of a woman to participate in the labor market on her characteristics, on the community characteristics, and on a dummy variable where she has a migrant in the household or not. I mean, you know, this is what I teach my students in econometrics course. Having this dummy variable, the introduction to econometrics, having this dummy variable would capture the effect of having a migrant in the household on female labor force participation. However, as we said, there's in selection bias, there is indigeneity. We are not sure if this effect is related really to having a migrant or to other characteristics. So this is why we corrected using PSM. And one way to do so, I can do the same regression, but I will use the weight of the p-score in addition to the weight of the sample to make sure that I am correcting for this selection bias. So we have two options. I mean, here I already estimated the PSM and I can use the p-score calculated in calculating the weights, or I can do all the steps myself, I would say manually, not through the command of PS match. So if I will do the steps, let me come here. So the first thing the PS match do is what? Is calculating, or sorry, estimating the probability of having a migrant in the household based on all the characteristics of the individuals and the community in the household. So I will do the same thing. I will start by generating the propensity score matching by estimating a probit model where my y variable is the treatment, which is 1 if the household have a migrant, 0 otherwise. On all the regressors I am including that includes the characteristics of the individual, the household, and the community for the sample in my study. I will run. Here you will see it is the same result as the probit model we observed in the first stage of the PS match 2. So we are okay. We have our model. As I mentioned, we can change the variables. We can include other variables based on the literature and on the table. Okay, second step. This is, I estimate the probit model, but I don't have you see that we don't have the p-score. We are not really having the p-score. So I will return back. I will predict the p-score, or I will predict the p-value. That is the probability of having a migrant, which is, in other words, the probability of being treated given your characteristics. And I will run it. Okay. So here you can see in my variables, I have at the end a new variable created called score, and this score is the probability of having a current migrant in the household given your characteristics of the variables included in your model. Okay, here you have the p-score I told you about. Okay, now I will calculate the weight. If you remember here, we said that based on the p-score, so here I finished this first step. I estimated the probit model and I calculate the p-score, the estimated probability of being selected in the model or being treated. Now I have to calculate this weight, which take into consideration if I am treated or not, and take into consideration the value of the p-score. This second step is calculated in STATA as this. Here, I will generate a weight. I will create a weight. I call it weight because it is inverse propensity score weighting, which is equal to C migrant, which is treatment, which is equal 1 if the individual is treated, which means if she has a migrant in her household, divided by score, the p hat, plus 1 minus T, which is the treatment, which is current migrant, divided by 1 minus score. So this command is just replicating this equation. Okay, I will run this one, and you see that you have variable called weight that it is created in your data. Of course, we have a lot of missing given the sample nature, but this is okay because you have enough observation. Okay, now I will not do this descriptive part. Now we have to run our regression where our y variable is our variable of interest, which in our case here is labor force participation, based on this new weight. Okay. Again, here the nature of the variable will differ in which model you are using. So because here my variable of interest is labor force participation, or the decision of the probability that women that it is variable equal 1 if the woman is participating in the labor market, 0 otherwise. So the regression I will conduct with inverse propensity weight will be a probit. If my y variable was income, or was the years of education, or was the number of publications, I will run a regression. It will be regress number, regress income on the variables, or regress years of publication on the variables. So here it would make a difference. But the first step, it is always a probit or logit, because the treatment is a binary variable. 1 if I am treated, 0 otherwise. But here now, I want to regress the outcome variable of interest, which can be any variable I'm interested in: labor force participation, women empowerment, number of publications, income, years of education, probability of being stunted or not for children. Here I will have to choose which model I will use: regress, OLS, GLS, or probit or logit, or whatever, based on any regression. And here I will, here you have just different steps with covariance, without covariance. I want to show you all the steps, but for sake of time, I will take the final one here. So I will run regress the labor force participation, which is my variable of interest here, on the variable of current migrant, which is my treatment here, the treatment I am interested to know its impact, and all the other regressions. So here's the regressions that we are used to know, that I am teaching for the first year introduction in econometrics, but without telling them that we have selection bias, that we have endogeneity. No, we stopped here in the introduction to econometrics. But now, because we know that we are more than first year or the third year, we need to control for this. So I will use the weight that I calculated, and this weight, as we saw in the presentation, it will provide more weight for those who were not supposed to be treated given their characteristics, but they were treated, or those who were supposed to be treated given their characteristics, but they were not treated. So there was not a good match for given their characteristics. I will give higher weight for them given the formula how I calculate the weights. So I return here, and if I run my equation, so here I have a probit model, and my variable of interest is current migration, and I have all the other variables, and my indicator is my outcome variable is the indicator of the labor force participation. What can I conclude from this regression regarding the effect of having a migrant in the household on labor force participation of women?
That's not significant.
I mean, it's significant at 10%, which is, I mean, high percentage, but we can say it is significant. And this explains why it depends on the matching points. Sometimes we find it significant or not. So at the end of the day, we can conclude that yes, it is significant, but the level of significance is not, I mean, it's not at 1% or 5%, it's at 10%. We have to be cautious about it. So I cannot really go to tell all women you have to make your men travel and to migrate so you can participate in the labor market. No. And if it's another program, so you have, so here you did the same thing. You control for the unobservable characteristics, and you measure the impact of specific treatment on an outcome variables, giving the PSM, giving this weight, take into consideration the observable characteristics that you are controlling for. And of course, if you, I mean, if you wanted to control for, if you wanted to present your results, it's better to do it, of course, as margins, not really in terms, I mean, in terms of odds ratio, to make sure that you are delivering the right message. And again, I can say it's not significant, as Noha mentioned, because at 5% and 1% it's not significant. However, still at 10%, it can be considered as significant. With this, we conclude that PSM is one of the methodologies that can be used to control for the selection bias. It would allow me in a non-random context to measure the impact of specific policy program or intervention on specific outcome. However, an important critique, first, the sensitivity to many steps, the selection of the X's, the selection of the matching methods. And also, in addition to this, you are not controlling for the unobservable characteristics that may affect your selection into the program and your outcome variable. And this is what we will overcome it tomorrow with the difference in difference methods, because it will allow us to control for the unobservable characteristics. However, it requires having a panel data, or at least in 2 rounds of the observations, to be able to compare between both of it. And with this, I will end my part here, and let me know if you have questions, comments, any point to clarify. I will share with you the do file if you have any comment, any question. If you are working on specific research question using PSM and you have any question, you don't, of course, hesitate to contact me. But let me know first if you have any question here regarding what I said today.
Just for on theta, if I'm estimating PSM with no weight, which is the original one, first stage and the ATT, is there a way to look at the effect of different variable on the outcome variable, like this last table? Or no, I'm just looking at the ATT with no specific effect of each variable on the labor force, women labor force.
Riham, I didn't get your question. So here I am just producing the margins for just the variable of current migration, but you can do it for
yes, for the table before this one. Yes, for this one we have here the different variable, the effect of different variable on women labor force. We did not get this table before when we estimate just the ATT. So
Yes.
is there a way to look at the effect of different variable on women labor force participation when I'm not estimating the weight? I'm
Uh,
not doing weight.
it will not be using the PSM.
Okay.
Okay, I mean you can do it by the regression, the general one, but the PSM is not. I mean, it's not really concerned in showing you the effect of each variable. I mean, the steps I mean, the theory of PSM is just showing you if there is a difference between your controlled and your treated, the difference in the value of your outcome variable between the control and the treated, and the only role of the x's you are including is to match between both. But it is not, I mean, it is not,
Our interest here to look at.
yes, I mean, how it is constructed, it will not show you what is the impact of x1 or x2 or any of your variables on your outcome variable. However, I mean, in your selection of the variables x's from the beginning, you are supposed to choose variables that would affect your treatment and your outcome variable. Both. But if you use the PS match command, you will not see the impact of these variables on the labor force participation. Because I mean, simply because you are assuming that they are, I mean, if I compare between you and me and we have all the characteristics equal and I am working and you are not, and I have a migrant partner and you are not, we assume that the only difference between us making me working and you not working is that I have a migrant husband. All the other characteristics are the same, so they are not affecting our decision of participating in the labor market. You see?
Yes. Yes. That's why they are not significant here I think in the last table, they are not very much significant. In the last table, yeah.
Here?
Yes,
No,
that's why.
I mean, no, here already the selection, as I told you, so here. Usually, I mean, unfortunately, in our region, education is not a key factor in explaining female labor force participation. Number of children, yes, maybe it's important. I mean, having elderly, it can be important. So here you are testing its impact as any regression on the labor force participation. But what I'm saying, so here it's, I mean, I would not tell you to exclude the education because education is a key factor. We have included, but it's not significant. This is given the specificity of our region. Okay. But what I am saying, why in the PS match, it does not show you the effect of these variables on labor force participation, because it assumes that there is no difference in these variables between those who are working and those who are not working.
Yes, okay.
Matching between both, they assume that these variables are not different.
It's no difference, no effect, you mean?
Exactly, it's not different.
Okay.
Those groups. So there is no effect on labor force participation. The only thing that will make a woman work and another one not, is not because of age, is exactly that treatment, that they have a migrant husband or not.
Okay.
Okay.
Thank you.
But again, when you are working with your data, you need to make sure that if the variable is not significant in the probit, whatever you are using, PS match or the propensity score inverse weight, it's not significant because it is really not significant in the literature, or it is misspecification of your model, or it is a variable that it is not relevant for your analysis. So you need to make sure that the selection of the x's correspond to the theory, to the literature, and not too many variables that you are not able to match. And then you can make sure that your results are robust for any change in variables or in the matching methods. Okay?
Thank you. Okay.
Any other question, comment, feedback? Everything is clear?
I have a question. I'm sorry if it's already answered, but since we tried different ways or different specifications for this method, and it gave kind of different results, is there anything that we need to look at to make sure that we choose the best method in reporting our results?
So again, the only rule of thumb I will tell you that usually, here I start from the opposite, but usually start with the easy ones, like with the closest observation, with caliper, with closest observation, n observations with the kernel density. If you run, if you run 5 times the model and 3 tell you it is significant, so it is significant. Okay,
Okay, and in this case, I should choose the model that gives me the highest level of significance.
So using the PSM, you have to report all your results. So I know it will be a mess because we are working on this paper with Marina. But this is really important when you are using a PSM, that you specify that you are using different matching methods, and the different matching method shows you if you, you would be good. It would be good if you have the same result for all the matching methods. But you need to report this. This is an important part to show that you did a robustness check. You made the matching method using the closest observations, the closest n observations, the kernel method, and based on the kernel method. This is the most complicated one or the most advanced method, so you can base mainly on kernel, but it will be good to try the other ones.
Okay.
And you report, for instance, the kernel one. So it's really important to mention. You can, it's a time of format. If you wanted to put all the tables in the annex, in the paper, you say that you tried it and you keep it without showing the table in the paper, But at the end of the day, you have to mention that you did your homework by doing this robustness check, that you have different results. But it will not be normal that the 5 ones, 3 give you significant and 3 give you not significant, or you will always have a dominant one, that it is significant or it's negative or not. If
Okay,
they are all, again, I always say, if they are all not significant, this means that this program have no effect on your outcome. If all the methods, the matching methods, shows you that having incarnate migrant have no significant effect on labor force participation, this does not mean that you have a problem. This just means that this program that has no significant
it's
effect.
not effective.
Yes. The quantitative analysis of TKAFL program shows that it has no significant effect on women empowerment. I can expect, because the program was not meant to be for empowering women. It was meant to to invest in the human capital of children. So again, but you want to do your homework, making sure that you make all your robustness check. You try several matching methods, and based on, if you do 3 and they have all the same conclusion, you can report this. If you do 5, you have 2 non-significant and 3 significant, you have to report this. If you have 3 not significant, so you can conclude that it is not significant, and it's possible that the program was not designed for this, so there's no problem in it.
Okay, got it. Thank you so much.
My pleasure. It's good to see you after this year.
Yes, it's my pleasure to be your student again, actually.
Thank you. Any other question, comment? Okay. So as in TV series, to be continued tomorrow with another methodology to solve the observable and unobservable selection bias given the characteristics of the individuals. Thank you so much, and see you tomorrow, inshallah.